Good afternoon, everyone. I'm Governor John Carney. Thank you for joining us for our weekly press conference on Delaware's response to COVID-19. I'm joined today by Jamie Mack, who's in charge of enforcement of many of the restrictions that we have, and businesses across our state has been working really hard over the past several months, working with the business sector and the community to find mitigation efforts and enforce those efforts across our state. Dr. Rick Hong, who's the Division of Public Health Medical Director, who's going to talk about the vaccines that are on the horizon. Dr. Rick Pescatore, our Chief Physician, who's going to talk about testing. We've done an incredible effort over the last 9 months, ramping up testing in our state to a level that I frankly didn't think we had the capability of doing. So I want to thank our team members for joining us today, and all of you. I want to start by wishing you all a happy Thanksgiving. Hope that you had a wonderful time over the weekend with your family and friends, and had an opportunity to enjoy some quiet time with small groups of folks. It was a Thanksgiving celebration in my house like no other. I come from a very large family, as most folks know. I have 8 brothers and sisters. Some of my sisters live out of state. My mother, who's 89 years old, is still here with us. But given the presence of COVID-19, we decided to celebrate in our individual families. And so that for me, that meant my wife Tracy and my sons Sam and Jimmy. We had a really nice Thanksgiving dinner. It was much quieter than it normally is in the Carney household when we have 25 or more folks joined around the table, but certainly just as meaningful as we thought about the so many things that we're thankful for at this time of year. It's a time where we do get together, and this is really an unprecedented time in the history of our state and the history of our nation with the COVID-19 pandemic, and really requires us to do things that normally would not be the way we'd celebrate a holiday. And as we start to move in to the holidays this month in December, just want to remind everybody that we're experiencing now a significant uptick of COVID-19 in our state. And we have to take measures to mitigate the spread of the virus. The more people who have the virus and are testing positive, and our numbers are frankly off the charts compared to where we were this at the low point at the latter part of this summer, and we'll talk about that. We're several times more on a daily basis, and our notwithstanding the significant increase in the testing, the percent of those tests that are positive is rising again. So we'll talk a little bit about that. We have some big decisions to make this week as we assess the data, as we look at the areas in our society where the transmission is taking place. There is good news. Yesterday on the White House conference call with the governors across the country, we heard another update from Operation Warp Speed on the progress the vaccine is making for COVID-19. Applications for emergency approval have been submitted by Pfizer and Moderna, and AstraZeneca is closely on their heels. And so the information that we're getting is certainly by mid-December, doses of the vaccine will be distributed to states across the country on a kind of prorated basis. 22 million doses of the vaccine for Pfizer, 18 million doses on the Moderna vaccine, and they will be distributed on a prorated basis. The amount of those doses that we're going to get seems to be a moving target. Dr. Hong is going to talk a little bit about that. That's the good news. The cavalry's on our way. It's just over the horizon. The bad news is we are seeing a significant increase in the number of positive cases of COVID-19. probably more so than we experienced at the height back in the end of April. And also concerning is the number of people that are hospitalized across our state. That number is rising. We'll see the numbers there in a minute. And that certainly is one of our biggest concerns and has been from the beginning, to protect the capacity in our hospitals to treat effectively patients who are COVID-19 positive. Those numbers, as I said, will be over 250 today and rising at an alarming rate. In a conference call with our hospitals yesterday, they felt confident of their ability to manage that surge. They have new and developed better treatment protocols for COVID-19. The length of stay of their patients seems to be a lot fewer days than it was back in the spring, and that's good news. We seem to be doing a better job protecting our most vulnerable population. The age demographic of those that are hospitalized is spread out a little bit more, but again concentrated in the 65 and older age group. But right now, that's a serious concern, and one that drives us to think about ways to mitigate, to prevent the continued spread of the virus across our state. And we'll be thinking about things that need to be done in addition to the mitigation efforts that we announced before Thanksgiving, which finally take place December the 2nd, December the 1st, for sports tournaments. And we'll be making more decisions to figure out what exactly we need to do with respect to the schools question. Our objectives, or two objectives, remain the same: to try to keep as many children in school for in-person learning as possible, and to keep as many people working and as many businesses operating as safely as can be done in both cases. Those are essential elements to our economy and our world, making sure our children learn and making sure businesses can stay in line. So we need everyone's cooperation as we think through the decisions we need to make this week, and we'll be talking more about those decisions in the days ahead. So let's go to the data dashboard. You can see there are 36,000 total cases since the first case back in March. The fatalities now are up to 777. Hospitalizations, as I said, very concerning at 246. If you look at Newcastle County, 20,000, over 20,000, 20,500. Kent County, 5,100, and in Sussex County, 10,558. The percentage of persons testing positive up to 16%. Obviously, this does not include people who are tested more than once. We'll see that number in a minute. But 6.8% of the tests that are actually administered are positive, and our goal there from the World Health Organization is to be below 5%. So that's a concerning number there. And our 7-day moving average of new cases per day is up to over 500 at 500 and almost 24. So here's the test-based reporting. The total number of persons that have been tested in our state, 427,000, and the total tests that have been administered, almost 750,000. Those are the different denominators as we calculate the percent positive of tests that are administered and persons that are administered to. The rate of positive cases per 10,000 by population age group. Every age group is on the rise. The young adult age demographic continues to lead the way. Moving on to the COVID-19 data dashboard. This is the 14-day view. You can see the top left. The number of current hospitalizations has risen pretty significantly. The new hospitalizations are at a higher level in the middle, top middle. And then the new positive cases continue to rise at the top far right. In the bottom left and center, the percentage of persons tested positive, you can see rising over the last several days. And then the percentage of tests that are positive still at a pretty flat level, increasing over 6%, as we saw a minute ago, which is concerning. If you take another step back and look at the 90-day view, you can see the run up in percent of persons and percentage of tests that are positive, the number of positive cases, and then hospitalizations are concerning. The percent of persons positive and test positive are the bottom left and center, new hospitalizations top left and center, and then new positive cases. You can see that significant increase. So all the on the personal protective equipment, all the beakers are full, so we're in good position and prepared there. Now, if we look at current hospitalizations, this is obviously something that we look at very seriously. You can see that we had our peak back at the end of April at 337. On April the 10th, just a week earlier than that, the number of hospitalizations was 181. So you could see that number accelerated just over a 7-day period of time. We gradually, as the number as restrictions went in place and the number of new positive cases flattened out, hospitalizations followed, where we had a low of COVID-19 hospitalized patients there at 29 at August 16th. And then after the increase in positive cases in October, we saw current hospitalizations just a couple of weeks ago, the beginning of November, at 107, and then yesterday at 246. We do have one of the as we talked to the hospitals yesterday, there was a mix of good news with the negative news around the increase in hospital cases, and that was that the number of days for hospitalized patients to be in the hospital is fewer than it was in the spring. The acuity of the disease seems to be less serious, and they've improved the treatment of those patients. Well, good news, but obviously the number of hospital beds that they have is limited. And importantly, the number of staff and the staff that they have for those beds and for the patients that would be in those beds is actually a limiting factor. And so consistent with our executive order in the spring, we're allowing healthcare professionals who are licensed in other states, maybe been retired for the past 5 years or recent graduates, to work in Delaware hospitals under appropriate supervision under this new emergency order that is very important to the hospitals and their ability to keep those critical care rooms operating. So effective December the 1st, Delaware youth sports organizations and team venues are prohibited from hosting or participating in tournaments with out-of-state teams. This is something that we announced before Thanksgiving that was to take effect December 1st. Again, an effort to reduce the spread of the virus at those tournaments, which we have seen is a concern. Just a reminder, we do have Delaware CARES Act relief grants available for hospitality industry businesses. Many of those businesses who were given grants earlier in the year were eligible for an increase in that grant, and those funds will be transferred to your bank accounts kind of as we speak over the next couple of days. For those who didn't qualify earlier, the application deadline for this kind of assistance is the end of the week at December the 4th, so don't forget if you need to apply for those relief grants. Lastly, just a note that today is Giving Tuesday, and a reminder to support Delaware nonprofits who have come up big during this COVID-19 pandemic, supporting community across our state, particularly those that provide emergency food and support, family support, particularly for the unemployed. Some great work being done out there by nonprofits across our state, and today is Giving Tuesday. Next up, we have, as I mentioned earlier, Jamie Mack, who's the Chief of Health Systems Protection at the Division of Public Health, has been doing an extraordinary job in enforcement of the restrictions that are in place across our state. And we thank him for his efforts over the last week and the last several months. Jamie?
Thank you, Governor. And I thank you for the kind words, and just have to say that I'm thankful to have a wonderful team, here at DPH that I work with that has just really risen to the task over the last few months. And I think they deserve a lot more credit than I do. If we look at what we've done over the last couple of months, and we go to the next slide, we've continued enforcement through the fall. We've done around 2,000 on-site compliance checks, and that's everything from bars and restaurants to retail establishments, offices, football games, school events, community gatherings. Really, we've been just about everywhere to ensure that everybody, knows what's going on, knows what the requirements are, and knows how to, continue with some of these activities safely. And unfortunately, we're still seeing some issues. So fines and other enforcement actions are becoming more common. And it's all because since we have been doing this for so long, we really all should know better by now. Everybody knows they should be wearing their face covering. Everybody knows that 6 feet of distance, and some of the other, restrictions that we have out there specific to different activities and events. Looking at the next slide, we can see, again, we're still seeing some of these very common themes among the violations that we're citing establishments and individuals for. And those come down to the three things that I just mentioned: the face coverings, social distancing, and capacity. We're continuing to see, some face covering issues. It's certainly gotten better, and it's obvious that everybody's really making an honest effort to do the right thing. But, as we've been in this for, 9 or 10 months now, it's getting to the point where we get a little complacent. It's just the thought is not always there like it should be with some of these things. So we tend to get a little comfortable, get a little closer than we should. Or, some of these businesses, I know they've been hit hard and they're working to do everything they can. And maybe they just try and sneak a few people in the door. We've seen that snowball in a couple of places, and it just doesn't end well for anybody. We have had a couple of challenges recently. We looked at last weekend, and if we look at the next slide, we'll see some of these requirements that we have in place now. And there was certainly a photo that made the rounds on social media about the food court at Christiana Mall. We had people on the ground at all three malls, as well as the outlets in Rehoboth, all through the weekend, keeping an eye on things. We saw a lot of good compliance in those areas, but we also saw some challenges. And while we think they were probably in compliance and probably maintaining that 30% restriction that they were required to at Christiana, it was obvious that even with that restriction in place and that number of people, it was still a challenging environment, and we needed to make some additional requirements to help them keep things under control and keep everybody safe. And so as of Saturday, all of our mall food courts are limited to a cap of 100. And that's, from Saturday forward, we are in conversations with the malls, talking about how we might be able to increase that, what other steps the malls can put in place, whether that be additional barriers, additional staff. We're looking at some of those ideas and seeing how we can help them adapt to the situation. Our bars and restaurants, we've limited the bars to table service. The pool tables, the dance floors, everything like that, that's going to be closed for now. The good news there is that restaurants can expand their seating capacity into those areas, just use them for more table service. And we now have face covering reminders on all the tables. So restaurants are one of our challenging environments because it's one of the places where, you have to take your face covering off. So because of that, we've put reminders on all the tables to remind everybody that if staff comes to the table, or if you have to get up from the table for any reason, we're looking for you to put those face coverings back on. And then one of our other challenges has been gatherings. And we see this on the next slide. we have indoor gatherings are now limited to a limit of 50. And that's for commercial and public places. It's 10 in a private home. But for those commercial and public places, the limit of 50 is not one that we have granted an exception to at this time. We've had, certainly some requests to do that, but we are sticking with 50 right now and for the future. We don't see any exceptions being granted there. Now, obviously, we're moving into the holidays. So if we can move to the next slide, we'll just take a quick look at some of the holiday plans. I know typically this time of year, there are a lot of parades and things going on. We've talked to some of the organizers, talked to some of the towns that typically do that type of thing. And right now, we are not granting permits for any gatherings related to parades. We had issued a couple earlier before the newest restrictions went into place. We have rescinded those or accepted revised plans from the organizers. And now we're looking at, kind of a different scenario, but we've got some great ideas that have come from people in the community onto how to do some holiday events safely. So we're looking more at things like reverse parades or drive-in tree lightings or, the contactless Santa visits that I think are going to be, the Christmas card of 2020, just plexiglass in between the kids and Santa this year. So we're just continuing on with, our enforcement efforts. Anyone that is looking to do an outdoor gathering, we ask that you submit plans to hspcontact@delaware.gov. And if we'll see on that last slide, that is also the address to submit any concerns, complaints, questions related to business or, other operations in Delaware.
Thank you very much, Jamie. Thank you to you and your team that were out there over a very busy weekend. As you said at the outset of your remarks, we know what works and we know what doesn't work, and we know what's required, and I know what's allowed at this point and what's not allowed. And we just need folks to wear masks when they're in public, particularly when they can't keep appropriate social distancing. They need to observe 6-foot social distancing. Business establishments need to work within the limits that are as part of the executive order. And the purpose of all of it really is to protect the spread of the virus in our community, to protect our ability to provide the essential workers needed both in schools and at hospitals. Our healthcare professionals and our teachers and educators are doing an extraordinary job under these difficult circumstances. Other essential employees who have to go to work the same. And all of us, we need the safety of a healthy community. And the only way to get there is through mitigation efforts that we know work. It's been proven with the first round of these increased numbers that we've had here in Delaware, across our country and around the world. And part of that goes back to these restrictions and Jamie and his team's enforcement of those. Next up, we have Dr. Rick Pescatore, who's going to talk about testing. Dr. Pescatore.
Thank you, Governor. I want to echo everything that Jamie said about the tremendous efforts of the team here at DPH and as well as our partners across the state. I want to talk a little bit about testing. Specifically, we know that there were a number of gatherings around the Thanksgiving holiday, and we want to encourage anyone who did gather with persons outside of their immediate family to obtain testing. We recommend that that be done about 4 days after your last exposure or gathering with other individuals. But certainly if you develop symptoms, we'd recommend that you would obtain testing right away. Now, just to highlight here, this is distinct from if you were recommended to quarantine as a close contact of a positive individual for COVID-19. In that case, you'd be recommended to quarantine, and of course, recommendations for testing will be relayed by contact tracers. But if you did gather with other individuals, or you're a college student returning to college, or perhaps you had traveled, we want to highly recommend that you obtain testing around 4 days after that gathering with other individuals. And to talk about where you can obtain that testing, we have a number of different different testing options throughout the first state. That begins with our fixed testing infrastructure at our Walgreens testing sites, a number of which are all over the state. 5 new locations were opened just today. And of course, beginning November 27th, those Walgreens locations transition to a reservation-based system in a design to ensure that individuals showing up for testing are able to get through a little more quickly and ensure that their spot is ready for them when they arrive at that Walgreens testing site. We will continue to open more and more Walgreens sites to facilitate testing throughout the state. And we also want to look at our state service centers. Our state service centers up and down in all 3 counties, which have access to saliva-based testing using curative testing. Those service centers are open. You can go to coronavirus.delaware.gov to find the closest state service center to you or the closest Walgreens to you to obtain testing. We have a number of semi-permanent testing sites, which are fundamental as part of our testing infrastructure and are led by our hospital colleagues and our hospital partners. Those remain at this time. And then we have our community sites. A number of Delawareans, hundreds of thousands, have obtained testing through our curative pop-up testing sites, as well as the new curative testing trailers, which are run through DEMA. Those are all over the state and will continue to be open for all individuals at all times. You can make a reservation online, and additionally, walk-up space is available at those curative testing sites if an appointment is not available when you check for one. Additionally, our community partners at LACC and the Kingswood Community Center continue to be open for testing through partnership with both our community partners as well as hospital partners as well. One thing that we really want to highlight is an additional option with our Vault at-home testing. At-home testing is a fantastic option for a number of individuals, specifically for any individuals who may have challenges getting out of their home. This is a testing modality that's reserved for Delaware residents only. Certainly, we have prioritized Vault at-home testing for teachers and faculty throughout our Delaware schools. But any Delawarean over the age of 60 or anyone who's been involved in a gathering where perhaps face coverings were not utilized or social distancing was not maintained, Vault testing is a tremendous option to obtain testing. Certainly, this is one of the ways that you can plan ahead if you plan to travel or plan to obtain a test in the future. All you have to do is visit our testing link, and we'll show you that very shortly. Obtain a test that will come to your home. You perform a Zoom visit with a medical professional. It's a saliva-based test where you spit into a tube over a Zoom chat just like this. The tube is placed into a UPS drop box, and you'll have results in just a few days. There is a high volume of requests for these tests, so we do ask that you plan ahead, and if you plan to obtain a Vault at-home testing kit, to leave 2 to 3 days for that request to be turned around and for that link to obtain a testing kit to be returned to you. To review this process very briefly, a home test kit can be requested at de.gov/home test. Once that URL arrives and you order a home testing kit, it'll arrive in your home. You do perform a video chat with medical staff from the Vault laboratory. That test will be administered, and then that test is shipped at no cost to you whatsoever, and results are delivered to you electronically about 48 to 72 hours after the lab receives the test. If you can get that Vault test into the UPS Dropbox before 3:00 p.m., it's often that those results will be in your hands within 48 hours. Now, certainly this is a testing modality that's reserved for those individuals who live or work in the state of Delaware, and you do need an email address for each individual person who's obtaining testing. Finally, the last requirement for Vault at-home testing is having a smartphone or a video-enabled computer or tablet, but I just want to stress again that this is an outstanding option for any individual who's planning ahead, who wants to obtain a test for any reason whatsoever. Any Delaware resident or anybody who works in Delaware, just simply visit de.gov/home test to obtain a home testing kit. And then one more pitch for our Walgreens fixed infrastructure, as well as our pop-up curative testing sites, which have done a fantastic job, particularly over the past week or so, as we've seen increased uptake in testing because of the holidays. And just one more time to remember that obtaining an at-home test kit is another excellent way to obtain testing. Thank you, Governor.
Thank you very much, Dr. Pescatore, and for your team there at DPH. Thank you for the great work that you're doing. We had an incredible surge in testing before Thanksgiving as students left our colleges and universities and went home as people were traveling around among states, and that was appropriate. Folks getting tested on their way to and from. And of course, now the post-Thanksgiving recommendation is if you were with people outside of your household for a social gathering, maybe headed back to college, as Dr. Pescatore said, you should wait 4 days after your exposure or immediately if you develop symptoms and get tested. Lots of options here in our state. Again, the testing numbers are off the charts and gives us a better handle on the situation on the ground in our state. So thank you to everyone who's availing themselves of these testing resources. Next up is Dr. Rick Hong, who's going to talk about help being on the way, the cavalry on the horizon with vaccine. With a vaccine update, Dr. Rick Hong.
Great, thank you, Governor. And I know that people are excited about this vaccine, and hopefully I can provide some overview or information on how the process is anticipated to work. So if you look at the first slide, we're going to talk about the two main manufacturers that we anticipate getting vaccines initially, which will be Pfizer as well as Moderna. As Dr. Ratain mentioned last week, the Pfizer manufacturer submitted its EUA request to the FDA on November 20th. We expect FDA's advisory committee, which is the Vaccine and Related Biological Products Advisory Committee, will be meeting on the 10th to finalize recommendations regarding the vaccine. And we are excited to see that the initial reports of over 90% effectiveness with Pfizer. We were concerned about the effectiveness of these vaccines, and glad to see that both Pfizer and Moderna are reporting a greater than 90% effectiveness. Now, Moderna filed its EUA, and again, EUA stands for Emergency Use Authorization, filed its EUA application on Monday, and we hope that the FDA's advisory committee could review on December 17th. We have heard a lot of concerns about side effects. Many of us who've received vaccinations know that there are potential side effects, and a good example would be influenza vaccine injection, where you might have some mild side effects. Usually these side effects should last for about 24 hours. And some examples of side effects could include injection site pain, as well as fatigue, some muscle or body aches, headache, or redness around the injection site. So just be aware that there could be some side effects. However, the majority of folks that did go through the trials initially had no issues with the side effects that may have presented. Next slide, please. Great. So kind of moving forward with the COVID vaccine timing, and this has been very challenging, and we've been working very closely with the federal government to kind of get the most up-to-date information. So I know that we've answered many questions regarding the vaccine, and it seems like the answers may be changing because the science, the process is being very dynamic as well. However, it's our job to make sure that we provide the most updated information so that we can plan appropriately, and not just planning within Division of Public Health, but also planning among our partners. We are very anxious for it to come, and we appreciate everyone's patience in the process. And this is the information that we have as of now. If you recall, the very first date of proposed allocation was November 1st. We are now looking at mid to late December for the initial supply rollout. And, as more vaccine becomes available, that the general public will have increased access to the vaccine. So, based on the projections, we're looking at spring for the general public. As I mentioned already, there is initially going to be limited supply. So on the next slide, we will talk about allocation groups. This is a phased rollout, and this is something I think we want to emphasize on the following slides. So looking at the anticipated tiered allocation groups, and again, these are still being discussed. We'll talk more about what's going on at the federal level to finalize many of these recommendations. But given the limited supply of vaccine initially, we anticipate that the first round will be focused on high-risk workers in health and patient care settings. And again, it could be folks that have routine exposure to either infected patients or infectious materials, as we anticipate that these groups have similar risk profiles. We will also be targeting first responders and EMS. Now, as we get more vaccine, we're going to move on to phase 1B. As you can see the slide here, the initial thought was that we had to complete everyone in phase 1A before we hit phase 1B. But as you can see from the Advisory Committee on Immunization Practices, that it is a phased rollout approach where we could start vaccinating those in phase 1B prior to finishing phase 1A. Which actually makes things a little bit easier from an operation standpoint, and also realizing the importance that we want to get the vaccine out there to as many people as possible. So when we look at phase 1B, our perception is that we want to protect our critical infrastructure workers. So you can see listed in phase 1B, essential workers, and we have some examples listed. But we also want to take in consideration those at higher risk for severe COVID-19 symptoms or outcomes. So here, this is what the initial recommendations are from ACIP, where they have a phase 1B and phase 1C. we are currently looking at these recommendations to see how we can balance between the importance of protecting critical infrastructure, but also protecting those that are at highest risk for significant or severe outcomes, which could be disability as well as death. So again, we're still waiting for more to come. ACIP should be meeting today to finalize its recommendations. Next slide, please. At the next slide, you're going to see another interpretation of the phased rollout approach of the vaccine. And here you can kind of see again what I emphasized before is that this is a phased rollout process. This is not let's finish phase 1A first and then we can go on to 1B and then 1C, that there could be simultaneous vaccination of multiple phase groups. And I think that's important to note because, again, our goal is to get the vaccine out to as many people as possible. So it's really going to be dependent on what resources are available, as well as how much vaccine we're getting at a time. So you can see here, if we do have 3 phase 1 subgroups, A, B, and C, you can see that around week 3, as phase 1A is in the middle of its vaccination allocation, we can start beginning phase 1B distribution. And you can see the bulk of phase 1B maybe around 5 weeks to 10 weeks. And then something very similarly with phase 1C, where we can start distributing in the midst of phase 1B, and then of course, you see later on as the vaccine supply increases, you can see around maybe week 10, week 15, we'll start vaccinating more in the phase 1C and so forth. So hopefully this gives you an idea, but again, I want to emphasize this is a phased rollout process. This is not, we're going to just do phase 1A first, and then move on to phase 1B, and then finish phase 1B, and then moving so forth and so forth. So next slide, we're going to talk about the task force meetings. We've had multiple meetings, multiple subgroup meetings as well too. We want to get as many points of view involved as much as possible. And also this is a huge undertaking. So we do want to work with our partners out there who've been great during this entire COVID-19 response, been great in testing, and also we would like to work together regarding vaccination. So we do have a state ethics group, and this group has been meeting fairly frequently to review some of these guidance that we're getting. Not only are we seeing what CDC's Advisory Committee on Immunization Practices is recommending, we're also looking at other experts that are out there to provide their recommendations. Some examples would be not just the CDC, but ACIP, but also your Society for Healthcare Epidemiology of America, as well as the National Academies of Science, Engineering, and Medicine. So all those recommendations have been very helpful for us to determine how best to approach allocation groups in Delaware, but also want to mention how important it is to look at our experiences so far in COVID-19. We want to look at our statewide data and trends and make recommendations based on that as well too. So it's not just cutting and pasting recommendations. We want to make sure it includes our needs within the state. And again, using our data and trends will be very important. We had a call, it was a required call with the CDC and HHS on November 20th, and that was an opportunity for us to talk about our plan to those agencies and to get feedback. And very happy to say that quoted that we were ahead of the curve in planning, and they felt that there should be no major barriers for us to be able to allocate vaccines as appropriately based on limited resources. Also to share that we have a new resource online. It's at de.gov/COVID vaccine. And this is an opportunity to share information, not just to the general public, but also potential vaccine providers. There are fact sheets for the public. There are also specific materials for medical providers who are interested in being part of the vaccine allocation process. We also included many links, including links to CDC, as well as provider FAQs, as well as documents on how to talk to your patients about the COVID vaccine. We have information currently available in Spanish. As more documents become available, I anticipate there are opportunities to translate documents into other languages as well too. So going to the next slide, just kind of again showing you what the website looks like. That the website again is de.gov/COVID vaccine. And this website is updated frequently to reflect provider and general public sessions. There are multiple links here. There are multiple buttons. As you can see here, we did divide it up to general public versus medical providers, so it makes it more user-friendly and making sure that folks are looking for the information in the right place. So if you haven't had a chance to look at this website, please do so, as well as currently, continue to look at our websites, My Healthy Community, as well as our general COVID-19 website. So just kind of talking about vaccine hesitancy, I know that there's some concern about safety There's concerns about whether it's going to work. We are excited about initial reports that the effectiveness of both vaccines are over 90%. But there are also questions about safety, and hopefully the website will provide additional information on the safety profiles of both these vaccines. But we also want to have testimonials from real Delawareans who are planning to get vaccinated, and you can kind of read their stories and find out why they want to get vaccinated. So this is the very first testimony we have, and you can see how it's going to work. We want to share this on our social media, just again, sharing opinions, reasons why we want to get vaccinated. And I'm excited to see the many reasons possible for wanting to get vaccinated. So again, hopefully this is helpful to kind of address the vaccine hesitancy. We are excited with the EUA process. I know it seems like this vaccine got turned around very quickly, but there's no corners being cut regarding safety. It's just a bureaucracy and the red tape that was shortened, the administrative piece that was shortened, but the safety piece was not shortened in any way. And I want people to feel confident regarding the vaccine safety. And again, rethink about whether you want to get vaccinated or not. But please don't let the vaccine safety concerns be an issue. We are in the middle of a pandemic, and one of the best ways to slow down or stop this pandemic is really get as many people vaccinated as possible. And so that's all I have left. Thank you.
Thank you very much, Dr. Honk, for that presentation. Help is on the way. The cavalry is on the horizon. We heard this good news yesterday with the White House task force, and we heard on your last point about the safety of the vaccine, the speed on which it was developed. Dr. Fauci from NIH commented on the transparency around the process, the independence around the process, the rigor of the process, and the confidence that he and others at the federal level have around the safety of this vaccine. It's obviously an unbelievable feat of public-private partnership in developing a vaccine like this that quickly. And having said that, it's a month away from being distributed in a widespread kind of way here in our state, obviously through the priorities that Dr. Hong outlined. That's part of our plan, consistent with the guidance from CDC. But we will encourage everybody, depending on their status on that priority list, to get vaccinated and to know that it's safe and that ultimately it'll get us back to a place where we want to be. Right now, we have a significant outbreak, forest fire, if you will, of COVID-19 raging across our state. We need to stamp it out. We need to do that to protect hospital capacity care, limited mostly by staffing limitations in each of the hospitals. We need to stamp it out to keep businesses alive and operating to the extent safely possible. We need to stamp it out to protect our children and their educational opportunities. Again, hats off to teachers and educators across our state and healthcare workers, first responders for their efforts under these very difficult conditions. We'll be in the process this week of evaluating additional mitigation efforts to halt the spread of the virus here in our state and to protect those priorities and those objectives. Remember the opportunities that Dr. Pescatore talked about in getting your COVID-19 status, getting tested, de.gov/get tested on the website. Significant opportunities there. We have lots of folks seeking out those opportunities. So that's both a good thing and a challenging thing in our teams that are getting people tested. Please download COVID Alert DE. It's a good way to get alerts about coming in contact with somebody who tests positive for COVID-19 and alerting you to actions that you need to take. And of course, we're in flu season, so make sure to get your vaccine today and fight the flu in our state. So we have media that's part of this presentation. We would invite any questions that they have, and we have some pre-submitted questions as well.
Governor, can you hear me? This is Sarah Gamard with the News Journal.
I can, Sarah. Thank you. Thanks for.
How are you doing today? The nation's top infectious disease expert, Dr. Anthony Fauci, said on Sunday that the country could see a surge upon a surge of coronavirus in the coming weeks after Thanksgiving, and that's likely not to ease up before Christmas as the weather gets colder and more people are expected to travel. So how is Delaware preparing for this expected wintertime surge? And by that, I mean, will there be ramped up testing, additional hospital sites, more contact tracing? I know you mentioned additional staff for hospitals, but what else can we expect before the vaccine is out?
Yeah, so all of the above are happening. First of all, it starts with anticipation and planning. We've seen this coming from late October, and you saw the run-up in hospitalizations that follows, increased number of positive cases. We are doing an incredible amount of testing. Our goal back after the surge in the spring was to do 80,000 tests a month. We're well over 100,000. I think north of 120,000. We've done 10,000 tests in a day, particularly in the lead up to Thanksgiving as people were moving. I think the challenge is that we've got a lot more movement in the community, a lot more people circulating and gathering. We have got pretty good compliance with mask wearing, which is really important, probably the most important thing that an individual can do to protect him or herself and their family and friends, to reduce the number of potential exposures. I mean, it's at some level, it's an exponential math problem. You just have to reduce the possibility of coming in contact with somebody who's COVID-19 positive. And so we're looking at all those mitigation efforts, looking at what other states are doing, looking at contact tracing. You mentioned staffing there. We have increased and onboarded more staff to do the contact tracing and trying to use the information that we glean from that to inform targeted mitigation efforts. We do not have at the moment resources like we did in the April-May surge to support businesses. Hopefully that can change. National Governors Association #1 priority is for additional relief resources, but right now we've got to work with what we have. And so, yeah, all the things that you've mentioned are things that we're doing, and we're going to be continuing to evaluate the effectiveness of the mitigation efforts that we've taken so far.
So across the country, hospital capacity is a concern. And I know you've kind of touched on this, but yesterday, California's governor said that his state's intensive care units could be overloaded by the middle of this month and that hospitals could be dangerously close to full by Christmas. At the rate that cases are increasing in Delaware, when can hospitals in this state expect to run out of beds?
Yeah, so that's a difficult question to answer, but let me just give you some context. The high watermark for hospitalizations back in the spring was 337, as I mentioned earlier, at the end of April. And we had accelerated up to that within a couple weeks time. We had gone from somewhere in the 100, 150 to 180 to 337. We're now 256, and we've accelerated from October, kind of in the low 100s to where we are today. The hospitals on our call yesterday feel confident in their ability to manage that capacity. Their biggest challenge is not so much the room space that they need, but staffing. And the more people that obviously test positive and need to be quarantined, the fewer staff that you have, the limitations on available staff in any case, which is why we have issued the emergency executive order to allow folks that may have retired, healthcare workers and professionals, to get an allowance to practice now and help the hospitals with that surge. We've also talked about, you may remember back in the spring, that we had conversations around surge hospital capacity at Nemours. We still have an agreement with them to do that. That would take about a month's time to stand up. We're pretty right now at 256. Our capacity is somewhere in the 400 to 500 range, depending on the activity in the hospitals, and they could curtail some of that. It's hard to estimate. That's why we need to, frankly, take efforts and call on everybody to protect that capacity and to protect our loved ones. But I wouldn't suggest to guess at when that day might come.
Hello, Governor. This is Sean Green with WDEL. You said during October 27th's press conference, when a question was asked about Delaware approaching the 8.0 threshold for switching to mandatory remote-only education, that those decisions should be focused on a geographic region where there are outbreaks. When Capitol announced they were using Kent County's data yesterday to defend their decision to close until January, you quickly tweeted out that state data should be used. What data should educators really be looking at?
Yeah, I think it's all of the above, if you will, and the context locally as well as the context statewide. If you look, and with the overall knowledge that we have gained over the last 9 months, that with the diligence and hard work of teachers and educational staff, that schools are safe environments. The children are wearing masks, they're socially distancing. We're not seeing a lot of spread within schools themselves. Most of that spread is coming from the community and informal social gatherings. It affects teachers, parents, and staff, to a lesser extent, children, who from time to time then are not able to work in the schools. And that's, again, consistent with the limiting factor in hospitals being staffing. That gets to be one of the limiting factors in the operational needs of schools, and something that we've started to focus on working with the superintendents and districts. And so the decision, I've said for some time, the decision about how to reopen sectors of our economy and how to reopen our schools are the most difficult. And I think these decisions around, once we've gradually reopened schools, and we have over 50,000 students across our state who are in some kind of hybrid learning model and some kind of in-person instruction, those decisions are the most difficult. So we'll be working with superintendents, with the teachers groups and educators. I think the priority will be certainly on the younger children, children with disabilities, as has been the case. I think we need to follow the science and the situation in individual districts, as well as the statewide data. One of the issues that you mentioned with respect to Central Delaware is that while the infection rates, and these are facts, the infection rates in Kent County are the lowest in the state. We've seen a run up lately in the percent to positive of those tests that are being administered. We're not as administering as many tests as we should be, probably, or not as many people are being tested in Kent County as should be tested. And so we're encouraging Kent Countyans to avail themselves of testing so we can have a good handle on that. But that'll certainly be one of the areas of focus as we assess the situation in the rest of this week and provide advice to the superintendents and school districts as they make those decisions. What we know, and what every governor in our region has shared, is that schools themselves are safe places and not places where there's much spread. The spread happens outside of schools and affects the operational needs of schools and classrooms. We also know that teachers and students and staff are doing a great job, following the restrictions operationally right now. The question is, as people move into, if they're test positive, they're obviously not able to be in the school setting, and that creates operational challenges.
Governor, it's Amy Cherry. Can you hear me?
I can, Amy.
Wonderful. Okay. Still on the education front here, the teachers union is speaking out saying that there's been a lack of transparency regarding all of the data surrounding positive cases that are connected to schools. And as a journalist, I'd actually agree that it's been extremely difficult to track and get that information on the district level. Do you think transparency has been strong enough on that front? And the way we're heading, do you fear that we could be returning to remote instruction?
Yeah, I think there's a difference between transparency at a more global level and transparency at a micro level. The fact of the matter is that we're limited in the data that we can share, like on a census tract or zip code level, just by HIPAA restrictions if the numbers are very low. And so we're constrained by the numbers that we can use. We do use zip code to a certain extent. We do use county level data, municipal level data to make a determination within a confined geographic area about what the condition is. And then we look at what's the situation in the county and across the state to make those decisions. But with respect to schools, the issue really is coming down to it being an operational one, much like the issue with respect to capacity in hospitals. Obviously, very different missions in those instances. And when I say operational, I mean if there are staff that test positive, they have to be quarantined, and so they're not able to be doing at their regular posts, and that creates operational challenges. With respect to the threat to spread to teachers and staff, we've learned that schools are safe environments, and that's why we've been emphasizing the need for mitigation efforts in other venues, so that teachers and staff and children don't catch the virus somewhere else and bring it into the schools. But the number of transmissions in schools is comparatively very low compared to other venues. And Dr. Hong, do you want to add anything to that with respect to school environments versus other venues?
No, I mean, I think you answered that perfectly. Fortunately enough, we are not seeing as high transmission concerns, risks, or cases within the school setting versus a community setting. And again, kudos to the school community for keeping that environment safe as possible with compliance with face coverings, mask usage, social distancing, as well as hand hygiene. I know operationally it is challenging, but we are doing our best to promote the science that we're seeing out there, as well as the recommendations from our federal partners in how to manage situations within the school settings.
And then to the question about transparency, Amy, we talk on a regular basis with the DSEA. We share with them the data that we're using. We interact with school superintendents and again share data with them. So we're sharing the data that we have, and we're having communications. All the data, more than you can almost digest, is available on our website, and we're not hiding that from you or anyone else.
Hi, Governor. Can you hear me? This is Nick Scialino with Delaware Public Media.
Yes, Nick.
Maryland Governor Larry Hogan recently granted early release to many of that state's prisoners to try to stop the spread within its prison system. With respect to Delaware's current outbreak in prisons, is the state considering any further action beyond what it's already doing within the prison system to try to keep inmates safe?
Yeah, no, we're doing a lot to try to keep inmates safe, limit the number of people coming and going into the prisons and visitations and that type of thing. Staffing being pre-screened as they come and go, requirements for them to stay safe, and we get pretty good compliance there. Obviously, when you have outbreaks, they can be difficult to control. We do look at and have looked at releasing, and we have put individual inmates up to the courts and the Board of Parole for release when appropriate. I've looked personally at those lists and am comfortable that there aren't people that would be eligible, that folks would be comfortable releasing them early to the public. We're not incarcerating and detaining as many in normal circumstances. The numbers are way down, somewhere around 4,000, which compares it's probably 25 or more percent lower than when I first became governor. And so, yeah, we are very cognizant of that concern and feel like we're taking the necessary steps to protect correctional officers and inmates as well.
Hello, can you hear me?
I can.
Thank you so much. I'm Katie Tabling with the Delaware Business Times. I had two questions for you. Frontline healthcare workers, first responders, and other at risk are considered in the tier 1 recipients for the vaccine. But I just want to understand a little bit more about how is the state deciding how to allocate the vaccine among those groups, especially since we're getting such small doses in the first round.
Yeah, so that's a question for Dr. Hong.
Yes. So, I think our approach is that, within each phase, there could be opportunities for subgroups based on risk profiles, as well as what we've seen, during this pandemic in terms of cases, as the governor mentioned about infrastructure within the healthcare setting, looking at our occupancy rates for hospitals, looking at just, how many exposure risks they have per provider, per staff, so all that comes into effect. It's multifocal purpose here because we want to make sure our health systems are intact. And given that the challenges with staffing at this point, the vaccine would help them significantly maintain those staffing to be able to expand capacity if needed. We also want to make sure that we're kind of addressing multiple groups within each phases. We don't want to just focus on one particular group because the fact is the entire infrastructure is composed of multiple disciplines. It's not just hospitals, it's not just EMS, that we want to kind of make sure that we're protecting as many groups as possible within those phases. And then from there, seeing what's happening. So it's a moving target right now because we are going to be dependent on what the vaccine supply is looking like and also the logistics and operational capabilities. If you're not aware, the vaccines have some limitations in logistics, not just from the storage. For instance, Pfizer requires ultra cold chain storage, which may limit the facilities that can manage that type of vaccination, and also the expiration date, so to speak, once the vials are entered. So all those things come to mind, but we all agree that we want zero waste. So we want to make sure we vaccinate as many people as possible. So that's part of our approach. Feel free to look at our website because we are going to post additional information as well as recommendations from those various agencies I mentioned during my presentation. And that might shed additional light regarding the science behind some decisions that are being made, implementation challenges, as well as the ethical principles involved.
You briefly touched upon the limitations in logistics, and I was wondering, does the state and healthcare systems have the necessary resources to store and transport the vaccines at this point? Some of them require sub-zero temperatures.
Correct. The good news is that the vaccine shippers that are sent with the vaccine initially has capabilities of managing that capacity of storage for up to 15 days, as long as we have the ability to recycle the dry ice that's needed to keep those temperatures. And then from then, specifically Pfizer, you have another 5 days opening or storage capabilities while refrigerated. So, we worked closely with the healthcare systems, and we're confident they're able to accept the initial vaccines and distribute it appropriately within their systems.
Hi, Dr. Hong and Dr. Pescatore and Governor Carney, can you hear me?
Yes, we can.
It's Cassie Simeon with WBOC. How are you all?
Good, Cassie.
I just have two questions, both for you, Governor, and for Dr. Hong. So it recently came to our attention that a negative COVID test is not part of the discharge procedure for people who spend a length of time in the hospital. One nurse in Kent County told a family of a patient that it was because it was, quote, too expensive and that I was not part of the procedure. And when the family said they were going to call the governor's office about it, the nurse said, quote, have the governor's office contact us. Why is this not part of the process? And is the state reconsidering making it a part of the discharge process, especially if the patients are older / immune compromised and have prolonged period time spent in the hospital?
So that's obviously a question for one of our public health folks. It's not an issue that I'm aware of.
Sure, so I'll be happy to answer that. And, Dr. Pestaracci has been more involved with the post-acute care stakeholders regarding this issue. This issue, we have to remember on where it was months ago with limited testing capability. And now, we may have expanded testing capability that we can consider this. But this is an operational decision and also a clinical judgment. And we would like to defer to our experts within these systems to make determination what is needed in terms of testing. However, also noted, testing only means that you are negative. If you do get a negative result, you're negative up till that point. So there's still potential that, and a false sense of security, that after that negative test comes back, the status may change until discharge from that facility. So, many of our long-term care facilities understand the non-concrete aspect of a negative test. So they have quarantine units, which will accept new patients or new residents as well as newly readmitted residents within that 14 quarantine period, just in case that they end up turning positive after some test of any sort during their hospitalization, to make sure that they do isolate or quarantine those folks until they clear the 14-day quarantine period. So it's not simply just a test. Again, there are gaps within any test that we have, and that's one of the gaps. That negative test that was done, let's say 3 days or 5 days before discharge, doesn't mean that they are absolutely negative upon discharge.
Okay. And my other question kind of goes back to what we've seen in the last 24 hours in Kent County. We saw 2 of the 3 markers go red in the last 24 hours. Governor, what are you considering if a potential, stay-at-home order is needed to bring down those numbers? Would you consider shutting down county by county rather than a statewide shutdown?
Yeah, certainly something that's we'd prefer not to do, obviously. And again, with respect to schools, which is where those criteria were, why they were developed, and for application with respect to the reopening of the schools. We've been saying for some time with respect to closing the schools, particularly based on what we've learned over the last 9 months, and in particular, since children have gradually gone back to schools, the safe environments that they are, just kind of a rethinking about what's appropriate and what's not, working with the school districts. Now, I say that recognizing that we had worked with the Division of Public Health and established those criteria in the first place, which create certain understandings and expectations at the school district level and in the community level. Our objective is to use, all the data that we have available, including what's actually happening in schools, whether there's compliance with social distancing and mask wearing, whether there's been much transmission, which there has not been the case, thankfully, and then the impact of the increased number of positive cases in the community as a result of that. And so we'll take all of that information. That particular dashboard was not meant to automatically signal that schools be closed once it passed that threshold, although that certainly was the impression that was given. So we'll need to work through that, really talking through what's acceptable and safe from a public health and from a medical perspective, and operationally, what's doable with respect to the support of teachers, staff, and parents. Dr. Hong, anything else on that? The criteria around school status.
No, I think, early on, we elected to use 3 metrics, multiple metrics versus 1 metric, because we feel that the 1 metric was not enough to really paint a picture exactly what's going on with the pandemic. So we included 3 metrics that would address the acuity, they'll address our testing capacity, and address spread or number of cases. So, we are happy with these 3 metrics. We understand that cases are increasing, our numbers are going the wrong direction, and we need to make sure that we are doing the right thing to maintain the safety within the schools and not making a quick decision without looking at trends.
Well, one of the things to the Kent County example that I mentioned a minute ago is that their infection rates are the lowest per their population than in the other 2 counties. And their testing rates are not as high in the other 2 counties, which affects the calculation for percent positive. And so we need to factor that into our thinking around what's safe and what's not. Again, working with teachers, working with superintendents and parents as well.
Hi, Governor. Can you hear me? It's Tim
Yes.
from the Delaware State News.
Yeah, Tim, go ahead.
I have 2 questions. First one is on the COVID Alert app. I was just wondering if you had an updated number of people using it, and what role has the app played in the state's contact tracing program?
Yeah, I don't. Maybe somebody does who's on the call. I do remember one of the more recent updates we had from the contact tracing was that something just below 20%, I want to say 17, 18, 19% of the individuals who were identified by contact tracers were participating in the app. So, depending on how you look at it, it's a good number or a small number. We'd like it to be more than that, but my recollection that was the number. And I'm looking if Dr. Hong or any of the others know what that number is, but I think you can get it if you connect with dealert.com. But we can certainly get you, Tim, that number.
Hi, this is Dr. Hong. So we did use a lifeline. So someone did text me the numbers. So thank you, Lifeline. So the total downloads of the app is 78,000 downloads. So that's an incredible number. And again, it is supportive of our overall contact tracing process, because the most important part of contact tracing is letting the person know you've been exposed. So whatever method there is, as quickly as possible to notify those close contacts they've been exposed, that's the key for effective contact tracing, to provide the recommendations that you should be quarantining to make sure you don't spread potential infection to others. So, this app is definitely complements what we're doing right now with our overall contact tracing strategy.
So that's just shy of 10% of the total population, and of course the total population includes children, which this does not.
Great, thank you. Second question is about restaurants. Obviously, those pictures on social media of the food courts on Black Friday kind of stirred up strong emotion, especially within the restaurant community. I'm just wondering, what would your message be to those involved in the restaurant community who were upset that something like that was able to take place while they're dealing with this 30% capacity limit again?
Yeah, well, it really pains me to have to impose strict restrictions on any business operation to effectuate the reduction in the spread of COVID-19. The reality is we know where COVID-19 is transmitted, and it's in gatherings indoors mostly, where people in restaurant, if restaurant, you could eat with a mask on, then it'd be not as big an issue. But obviously, that's ludicrous. You need to take your mask off when you're eating and talking and whatever, and that's what creates the challenges for restaurant venues. We've tried hard to enable businesses to get revenue, to stay open in a way that's safe. It doesn't. But if you look at the information with our contact tracers, the highest number of responses for places where people have been in restaurants. and bars and gyms, places where people gather, and particularly where people gather and are often drinking alcohol and they're relaxing, and that's problematic only when you have a pandemic and you need greater discipline and greater distancing and the wearing of a mask. So obviously, we're doing everything we can to prevent the spread of the virus and enable businesses to stay open and to get revenue. And we've made special accommodations to that with outdoor dining, with off-premises sale of alcohol. I'm certainly sympathetic and supportive of our restaurant industry, but I have an obligation, as we do, to take action to reduce the spread of this with this virus, which to date has taken the lives of 777 Delawareans.
Hi, Governor. We have a few pre-submitted press questions. Can you hear me?
Yes, I can.
Okay. First is from Jared Leedy at WRDE. Could you clarify how AJ Shaw contracted the virus, and how are you not considered a close contact?
Yeah, so the question about how AJ contracted the virus is better addressed to AJ, and he's not part of the group today. My general understanding is that he came in contact with someone outside of the work environment. The thing about him being exposed and testing positive is that he's very careful. He wears a mask. Certainly, when I see him all the time, he's wearing a mask. He's very conscious of the restrictions with respect to 6-foot distancing, and I'm sure that's the case with respect to his private activity as well. But it just goes to show you, frankly, the insidious nature of this virus, that you can come in contact with somebody in a way that's very unexpected. That person just happens to be COVID-19 positive. You're there within 6 feet for more than 15 minutes or whatever else it might take for that transmission to occur. And then you're subject to testing positive and the limitations thereafter. While I have acted as if in the abundance of caution in terms of keeping distant from family members, friends, the public, even public, canceling my so-called public schedule. I was not determined to be a close contact because when we were together, we were 6 feet apart and both of us wearing masks, with the exception of on the mask wearing side, with the exception of our weekly press conferences when AJ was present, but otherwise, I believe we were positioned 6 feet apart as we were on that stage. So that's the reason. And again, AJ, I'm sure, followed the appropriate protocols as he did on the job when he was outside of the work environment, because for a first responder like AJ, he's always at work and on the job.
All right, this is the final question we have time for. It's from Matt Biddle at Delaware State News. Some of the Republican lawmakers say the governor is not keeping the legislature in the loop with your decision-making process. Governor, what is your response to that? Do you feel lawmakers' concerns are being fairly considered?
I do, and we've heard this concern before from Republican lawmakers, I might add. We do have regular phone calls with members of the General Assembly and leadership, and expect that leaders, as they do, meet with their individual caucuses. Our leadership at the Department of Health and Social Services and the Division of Public Health have calls separately with legislators. I can tell you that the emergency powers vested in the executive branch are granted to the executive branch through the legislature and the statute, and they recognize that decisions have to be made expeditiously and, frankly, using the resources and apparatus of the state government. I can tell you that in the updates that we give, and we take calls from legislators, Democrat and Republican, on a regular basis as well, and seek out their advice and guidance, and at least allow them to let them know what's about to occur. That some of those legislators think we're not doing enough to shut down sections of our economy or to impose restrictions. And some of those think we're doing way too much and shouldn't do much at all with respect to restricting business activity. And that is to be expected to a certain extent in a democracy where people have differences of opinion on just about every issue. So the idea that somehow we'd be able to come to quicker, different decisions through a legislative process, I think doesn't recognize that reality. We make every effort to keep business sectors apprised, having regular conference calls with our hospitals, with our other elected officials, including members of the General Assembly, with the Chambers of Commerce. We had a significant resurgence committee that came up with a series of recommendations developed with the interaction of all these business sectors and with members of the General Assembly as well. So you're always going to hear that complaint, particularly from legislators whose opinion is not being implemented in some way or another. And that's just part of the democratic process. But I do feel like we're keeping members of the General Assembly up to speed on what's going on.
Governor, we had a quick question from Matt Biddle, just to end on a positive note. He asked, do you believe the Eagles should start Carson Wentz or Jalen Hurts at quarterback?
Well, first of all, I can tell you that that's not ending on a positive note. After watching the performance of my Philadelphia Eagles last night on Monday Night Football, where the incumbent quarterback, Carson Wentz, did not really perform up to snuff, and he hasn't of late. I guess I wouldn't be of the mind to make a change. I would like to see maybe his backup, Jalen, get a little bit more playing time, particularly now since I guess maybe we have a chance to win the division. The NFL East is in pretty bad shape. But at some point, when there's not a chance of making it into the playoffs, we ought to, create competition there and see who comes out on top. I think the problem is not so much the quarterback, although I think he's clearly lost confidence. But on the offensive line, if you put Carson Wentz behind the Green Bay Packers offensive line, my guess is that he'd look a heck of a lot better than he did last night with our offensive line. And we don't have skilled players that are making the play and getting separation down the field. Anyway, we could talk for a long time on my opinion about our hapless Philadelphia Eagles. But now just to thank everybody for joining us on this weekly press conference on COVID-19. We are we have hit a tough spot here with an increase in positive cases of COVID-19. We have some difficult decisions to make as we try to get this surge under control, protecting our hospital capacity, protecting essential workers and vulnerable populations, flattening that curve and doing what we can to have a healthy community and a healthy economy. And I can tell you that those decisions are difficult ones and ones that we will do our best to seek out the best advice and come up with the best path forward. So with that, I just want to thank our team at the Division of Public Health. Doctors Rick Hong and Rick Pescator are here with us today. Jamie Mack, whose team is doing a great job with enforcing the restrictions that unfortunately we have to impose on business sectors in our state. And for all of you for pitching in by wearing your masks when you're in public, by keeping appropriate social distancing, and by taking care of vulnerable family members and neighbors. Thank you all for joining.